right, Patrick. I need some history from you. What happened today?
Today, I just got up, did some toast, and came to the hospital.
Okay. Why did you come to the hospital? What was it that caused you to feel like you needed to get evaluated?
Just a really bad chest pain. Just all of a sudden happened. I had to hunch over to walk. Lessened when I sat down. Couldn't lay down on my back to that side.
Is that right? What were you doing when it started?
Driving my truck.
So just driving your truck, and all of a sudden you had the sudden onset of chest pain.
Yeah.
Do you smoke?
Nope.
Good, good. So you don't smoke. You're fairly tall. You're a fairly tall guy, and you're fairly thin. So those are people who tend to have these pneumothoraces. And do you feel real short of breath?
Not right now.
On your chest X-ray, you do have a very large collapsed lung, so a large pneumothorax. Your collapsed lung's very small because it's collapsed. What do you do for a living now? Are you students?
I go to Gusty Tech.
Okay, all right. So Adrian, what are you giving as far as pain medications?
So just pre-medicating for anxiolysis with 1 milligram of Ativan IV, and also with 25 of fentanyl IV. We're going to hold an additional 25 of fentanyl for further analgesia as if needed for the procedure.
Okay. Patrick, you have no medical problems of any kind?
Okay.
Okay.
Just to kind of walk through the procedure, it's going to be second intercostal space, mid-clavicular line, where we'll be introducing our needle and our incision will be made ultimately. So I'm just feeling for my landmarks at this point.
So you're using the true closed system?
We're using the Uracil, which is a true closed system. It's a chest tube that actually fits onto the chest as an apparatus and doesn't require the atrium, can be just hooked up to low intermittent suction directly to our wall suction.
So he can get up and actually walk around after he's had this place.
That's correct. And for a stable pneumothorax, this is the ideal, meaning a patient who has no respiratory distress or profoundly hypoxic crashing. This is the procedure of choice.
You get all clean. Let me put this away.
So why is it, in your opinion,